on the for the presentation. She will be presenting on BRVO with CRVO, and Dr. P. Lakshmi Priyanka also to be ready with a presentation. Please start.
So, good afternoon everyone. I will be presenting my case on concurrent central retinal vein occlusion along with branch retinal artery occlusion in a young male. CRVO and BRVO are distinct retinal vascular events that they usually occur independently and in individuals well over the age of 60. But it has been seen that their simultaneous occurrence is usually seen in younger individuals. The pathophysiology basically either involves a thrombus blocking the central retinal vein and then slowing the blood flow in the arteries, and then sluggish blood flow again enhancing the clot formation. And then also since it has been more observed in younger individuals, the increased physical activity causes dehydration resulting in hemoconcentration and also then again promoting the thrombus formation. And these are the other systemic vascular diseases, hyperviscosity syndromes, inflammatory causes and hypercoagulable states, which again promote the thrombus formation. So now beginning with the case, a 41-year-old male presented with the chief complaints of sudden painless diminution of vision in his right eye for the past 2 days. There was no such other significant complaint other than this, and the past medical and the family history was non-significant, and the personal and social history was also taken, which includes there was no history of smoking, alcohol or drug abuse, and there was no history of excessive physical exertion prior to the onset of symptoms. The general physical examination was well within the normal limits. The vitals were stable, the systemic examination was normal. The diagnostic workup for this patient was done. The blood profile was normal. On echocardiography, a trivial tricuspid regurgitation was observed, and for which the patient was advised cardiology opinion, but again it came out to be non-significant. Then the ocular examination for the patient was done, and the right eye it revealed a vision of finger counting at 5 meters. The ocular motility was full, adnexa within normal limit, anterior segment slit lamp examination within normal limits, and after that the patient was dilated, and we could see multiple retinal hemorrhages in all the quadrants, dilated and tortuous retinal veins and optic disc edema, and a localized area of retinal whitening along the distribution of a branch retinal artery, and the NCT was also normal. In the other eye as well, we can see areas of focal arteriolar attenuation, and along with them some degree of tortuosity present. And on the OCT, there's a macular edema is seen in the right eye with a CMT of 582. The visual prognosis was explained to the patient, and then later the patient was planned for 3 monthly injections of ranibizumab, but the BCVA just improved to finger counting at 3 meters from finger counting at half a meter. And along with that, the patient was advised lifestyle and preventive measures, and the patient is kept for routine follow-ups to look for any subsequent neovascularizations. In my discussion, I would like to state a systemic review which was conducted by Pina et al. In Italy, which included 29 patients of combined BRAO and CRVO from the past 3 decades. The study found that among these 29 cases, 17 had an underlying risk factor. 2 of them, the events were triggered by some strenuous exercise, while the 10 had no underlying identifiable risk factor. And currently, insignificant evidence is available to establish a standardized treatment approach for this rare concurrence. Thank you.